So hello and welcome to another segment of Elder Abuse Awareness Virtual Coalition. My name is Elisa Gwilliam, and today I have the pleasure to be talking to Director of the Orange County Office of the Aging, Anne-Marie Maglione, and Professor of Psychology and Director of the Center of Aging and Disability Policy at Mount St. Mary College, Dr. Larry Force. So how are you all doing today?
We're doing great. We are doing great. Thank you for moderating season 2 with Anne-Marie and myself, and today now with Tim Murphy, who you'll get to meet in a minute. Look, we're honored to be here. You know, we started off in a conversation with Tim and Anne-Marie, and then we had another conversation with Tim, Anne-Marie, you, Alyssa, and Dr. Jerry Abatiello. And you've heard this in season 1. 11 days later, we were up and running. And it was so successful that now, with the support of Orange County and Steve Newhouse, we're back for season 2. And season 2 has a special focus, and we're calling it the blending of concerns. And the focus is on specialty groups of veterans, specialty groups of people in nursing homes, and specialty groups of families with individuals with special needs. And that's our agenda for this season, to be able to highlight the concerns, add voice and advocacy, and to let people know that they don't have to do this alone. Individuals don't have to do it alone, families don't have to do this alone, and agency staff don't have to do it alone. And the two people that are on this video cast today are really and I say this, you know, not just because they're here, but they are really the who's who of Orange County when it comes to advocacy for, you know, seniors and adults. And with that, I'd like to introduce Anne-Marie Maglione, excuse me, the County Director of Orange County Office for Aging. And then she will introduce Tim, and we will have this unbelievable, informative exchange. So thank you, Alyssa. Anne-Marie?
Thank you, Dr. Force. I'm delighted to be here. And Alyssa, thank you. You do such a wonderful job. I can't believe that season, you know, we've gone through season 1 already. And as Dr. Force said, we had many people that were tuning in, and it was really helpful. It was helpful to families, it was helpful to older adults, and you know, we're living in strange times right now, so everything is different, and isolation is a huge issue with elder abuse. So isn't that what we're doing right now? We don't know what the fall is going to bring us. You know, we hope and pray that it's not going to be a second wave, but you know, regardless of where we are in our country, we have to address and try to eradicate elder abuse. And we know that it's an epidemic, and we're dealing with an epidemic during a pandemic. And I say that all the time, but it's really true. And education is the major tool to eradicate that. So that's what we're doing, and focusing on these 3 very important groups, I think is really brilliant, Dr. Force, because everybody that deals with elder abuse has their own story to tell. But if you add the components of, you know, veterans and what they're going through, and special families with special needs and what they're going through, and nursing homes, it just makes it that much more difficult. So you need to know we're here to help you. We're getting a lot of feedback. We want to continue to get the feedback because we want to try to serve you. We want to address the needs that are out there. I'm very fortunate that I work with such an intelligent colleague, Tim Murphy, and Tim Murphy is a case supervisor for Adult Protective Services, and we work hand in hand. You know, I always say that we'll get the cases that really are very, very difficult, and I'm fortunate to be able to have the resource in Tim to really help us out and take it over. So in saying that, I think it's a good time to introduce Tim Murphy, Case Supervisor for Orange County Adult Protective Services. Thanks for being here, Tim.
Thanks, Anne-Marie. Dr. Forrest, Lisa, nice to see you guys. Welcome to season 2. This is pretty exciting, especially with the specialty groups and the significant challenges that each have in dealing with their issues and in the middle of a pandemic, which adds another layer to all the work that we do.
Yeah, and I think, as both of you were talking, I'm realizing that both of you, both personally and professionally, are just a phone call away. And we've all have come across incidents or concerns where we need guidance. And without any type of hesitation, I'm on the phone calling one of you or both of you. So for that, I really want to thank you on behalf of myself and behalf of the residents of Orange County, because you truly, are on the job. Even during this COVID, and how we arrived here with the support of Orange County is to be able to develop a presence and be able to distribute content knowledge. The concern is, we're not in a position to assemble. The three of us, quite clearly remember the days at Mount St. Mary College, where our Center on Aging and Disability is housed. We remember the days of being in an auditorium surrounded by 500 people. Those days are not on my calendar for quite some time now. So now the question is, how do we go about getting out the information? And that's why we came up with this idea of let's do it this way. And how it's been received locally, statewide, and nationally. As I tell my students, I'm a big believer in connections. It was because of the connection with Anne Marie that she had the connection with Greg Olson at the State Office for Aging, that he was on our second episode, which is a tremendous testimony to the importance of what we're doing. So as we started to come out of season 1 and started to talk about season 2, we started to talk about specialty groups. And we identified 3 for this season: veterans, nursing home residents, and families with special needs. So maybe we can, and we don't have to do them in any particular order, but maybe we can address some of the concerns that we see when it comes to these different special groups. And they are special in so many ways.
Mm-hmm.
And I like to launch that part of the discussion, but the idea of veterans. I mean, Alyssa, you can contact her just like you can contact any of us directly. She, with Mental Health of America, Dutchess County, are working on a program using a hyperbaric chamber to deal with PTSD for veterans, and it's free. People need to know about that, and the fact is what a tremendous opportunity is for veterans and veterans groups to connect with her in her Hudson Valley Healing Center. The idea of, veterans, I just read recently in a newspaper that a fellow that was in the Korean War ended up committing suicide. And his family was so devastated for so many reasons. But one of the things that added to that devastation is they couldn't get to him. He was in a nursing home and they couldn't get to him because of the fact that he was isolated. And maybe what, Anne-Marie, you and Tim can talk about are some of the things that you see as far as what's percolating to the surface, because we all know that child abuse is increasing, elder abuse is increasing. And the reason is because of the fact that people are being quarantined. Mm-hmm. And where people might be noticed in a work setting or for young kids with child abuse in an academic and educational setting, that's not available now. So maybe the two of you could start that dialogue about what you see and how you see that we could be available to veterans and veteran groups.
I think it's very difficult. Isolation is a huge issue, and you've really hit the nail on the head. It's an issue because when you're kind of priming somebody to abuse them, you isolate them, you separate and isolate them. Well, isn't that what we're doing during the pandemic? But in addition to that, people are getting really anxious and depressed and lonely. And that's because of the isolation. Now, we have to do that to try to eradicate this pandemic, but it leads into self-neglect. It just harvests an arena for all kinds of things. And there's a lot of services out there. Our Veteran Service Agency in Orange County is really great. We have Vet to Vet, that's really good. But it is an issue, and I think there's been an uptick specifically in veterans abuses. And Tim, maybe you want to talk about that a little bit?
So it's really difficult to help veterans, especially with PTSD, combined with age and other illnesses, to help them make that leap or that bridge to protect their independence or make sure they have access to the services they need. Sometimes they're not that they're shy, but they're very reluctant to tell their stories. They're very reluctant to reach out. Peer advocacy is a major role and tool to use, and there are not that many peers within the veterans groups that we can readily reach out to because of the COVID restrictions. It's very frustrating for all of us that are trying to do the right thing. As much as we can contact our Veteran Service Agency or Castle Point as a VA hospital trying to make referrals and links, it's difficult to bridge volunteers and peers out into the community. So they tend to suffer in silence, and it's very frustrating when you see someone kind of slipping away when they deserve more or a different quality of life than they have. So it's frustrating to the adult protective staff trying to make the links. And
probably about 2 months ago, Alyssa and I, through the advocacy of Stacy Orzel, met with a group of veterans at Alyssa's Hudson Valley Healing Center so she could show them what this program was all about. And one of the things that came up that I was really taken by is the fact that they really value the voice of a vet helping another vet. You know, it's not somebody who hasn't been through that experience telling them what they should feel or could think or whatever, but the lived experience. And I think in all of these populations that we're looking at, the specialized population, that lived experience, that peer-to-peer, as you mentioned, is so important because it adds a depth to the outreach that may be absent if, you know, the person doesn't have that experience. And the thing that came up is that in the discussion with this group of men and women, one of the things that came up was not only were they there for themselves, but they knew of other people in their group that they had concerns about that would not be willing to step out, raise their hand, ask for help. And they wanted to find out what types of things would be available so they could deliver that to the person. And I think that's an important point that, you know, everybody will reach out with their own style. But the thing that, you know, people need to hear clearly when it comes to interacting with both of your government-based county agencies is confidentiality is key. People can call you and have a discussion with you, but they know that they are assured that it's not going to be made public, you know, with a concern. So let's talk about that for a moment. Let's say that there is a family out there or a staff in some type of setting or a friend that notices that this person over here, this imaginary person over here, is having some concerns and they're concerned about them. What can they do in order to bring you into the discussion, both of you?
Well, you know, we always say you should call our New York Connects number, which is our single point of entry. It's 845-615-3710. The veteran can call, a family member can call, a friend can call, and it's very confidential. You know, it's really critical. You're right, confidentiality and trust, because they're talking about things that oftentimes they're ashamed of. They see it as a weakness, and it's not a weakness, but they see it as a weakness. So to bring it up and to start talking about it is really difficult. So to kind of let them know, you know what, this is a safe place to come. This is a warm place to come, and we'll take care of you. And from there, what we'll do is we partner with Adult Protective Services, and we call Tim, and Tim gets involved, and then we call Larry Newman from Vet to Vet, and they get involved, because I think that is the critical piece. You have to have a peer talking to someone else. If you are going through this, and these are people sometimes from the Vietnam War that they've just lived with this, and it's now they're getting older and it's just getting really difficult. Well, I'm not going to know what they've gone through. I've never been through war, but to have a peer talk about it and just say it's okay. It's okay to feel this way. It's okay to, but you don't want it to ruin your life, and you don't want it to lead you down other paths. And there's help out there, and we're here to assist you. I think that's the big part of it.
And Tim?
When the degree of risk gets high enough, or the person is being victimized by third parties, then those calls come into Adult Protective Services. So for the Office of the Aging, there's a direct link to us, and an understanding that they can email, they can fax, they can call, and they've already done the initial assessment. And we being Adult Protective Services, are going to take that and do some outreach. But the public and the community needs to know that there is a high level of confidentiality that exists here in Adult Protective Services, especially when you're talking about issues of adult abuse and neglect or serious self-neglect. It's only a handful of people here in the office that are working on those issues. In the Office of the Aging world, there is a discussion about what's available out there, and they seek to empower the veteran or anybody that's referred by asking permission, talking about the resources, talking about how they're going to make the links. But our role is more investigative and assessment. And then there is a discussion about how to put those pieces together. APS has to snoop a little bit more into a person's personal affairs, medical affairs, financial affairs, and we take that very seriously. And it's really tough for the person who is being assessed to kind of understand that and appreciate that we're trying to watch out for the whole person and to make some safe walls around them so they can get where they need to go. But it's a process. Adult Protective Services is not an emergency responder. So people who are at serious instant risk, law enforcement could be called. We do have a crisis hotline through our mental health department that's available 24/7 as well. So there are some other resources that are used in the emergency. But we're here for the longer term of an assessment of the person's life and trying to guide their decisions to reflect some better decision making and empower them at the same time to get them to speak up for themselves. Lara, you and I have always talked about age loudly, so you can't be quiet about these issues. You need to be able to.
You can't, and you bring up an excellent point. I mean, I have a small private practice, and guidelines of confidentiality, the ethics of confidentiality, are the overarching principles, except under two conditions. If you come in and you tell me that you're going to injure yourself or injure somebody else, then the confidentiality is pierced. And the fact is that if you, as a staff member, as a family member, as a neighbor, if you really feel as though that somebody's in jeopardy, where the interpretation of their behavior is they're going to hurt somebody else or they're going to hurt themselves, the most important numbers are 911.
That's correct.
It's better, you say that Adult Protective Services is not an immediate response, but 911 is. And many people have come into recovery through the doors of an emergency room. We talk about the fact that people in this country, not everyone has health care. That's true until you end up knocking on the door of an emergency room. You're always going to be giving care. And the fact is, if you feel as though that you yourself, this whole idea of suicide ideation, do people think about, who, the question is, people that think or perseverate on issues of suicide, are they at a higher risk? My answer is, I don't know. In front of my students, one of the things I say at the very beginning of the semester teaching clinical courses is the most predictable thing about human behavior is that it's unpredictable. You just don't know.
Mhm.
So if somebody doesn't talk about it, does that mean that they're not at risk? I don't know. I mean, everybody, you know, lives uniquely. But if you are a witness to this, or you yourself are monitoring your own thoughts and you're concerned, raise your hand. You can raise it in a very confidential way. And the fact is, when you raise your hand and knock on the door, whose arms do you fall into? You fall into your arms and your staff and Anne Marie's arms and her staff, and they can surround you and they can help guide you.
And that's a good point, that, you know, if you think something's going on, err on the side of caution and reach out to us. Give us a call. You know, Tim mentioned our new 311 Orange County crisis call. It's manned by mental health professionals. Call them. We can help you. Best case scenario, it's diffused. It's not a big deal. But if it's more than that, you've started the process and you've started the healing. The first step is the hardest, but that's the one that you have to take. And you need to know that there are people here that can help you and care.
Absolutely. And I think that's a good transition about people being there and being able to care and to help you. Let's take a look at the next specialty group that we're going to highlight this season, and that's individuals in nursing homes. This has been an unbelievable experience for individuals and their families in nursing homes. And when I say this, during the COVID, quarantine, people not being able to have access, people being asked to leave, services being diminished in some cases. And each place, and this is not a banner statement for the whole nursing home industry, there are some really good places out there. I mean, on a personal level, I have an older brother, and the fact is, I remember we made close to deathbed commitments that mom would never go to a nursing home. Well, the events that occurred with her falling and breaking her neck and being two sons, and there's a lot of things that we can do, but there's a lot of things just based upon the issue of dignity that we're not going to be able to do, for her. And she spent, the last 4 years of her life in an unbelievable nursing home in Westchester, St. Cabrini. And the first night that she was there, when we were able to get her transferred in through a friend of mine, she said to me, you know a lot of people around here, don't you? And I said, yeah, I do, because I worked for the state. I did a lot of training in those areas. So you have an idea of places to run towards, places to run away from. And Cabrini was a place to run towards. And I said, yeah, I do. And she said, so you put me in here to die, huh? And it was like getting hit in the head with a bowling ball. I'm like, well, you gotta be kidding. So the next day, that was a long ride home. I come back the next day, same thing. So a lot of people put me in here to die. I said, no, we made these arrangements so that you would be able to live. I mean, you could come live with us in Dutchess County. He's like, I'm not going to the country. I mean, she had these things that, she was very familiar with her religious symbols and the area that she lived in. And in that 4-year period, she became a rock star, and they loved her, she loved them, and she then started to refer to it as her home, which was something that never would have thought of the first day. So now we get fast forward to today. Now we get to COVID, because that nursing home was arms open. You could come in anytime. You didn't have to call. Your family's welcome. We encourage that. And now it's like, the doors are locked. My sister-in-law, my brother's wife, has been in a rehab center now for coming up to about 90 days. I won't name the rehab center, but the fact is that they've dropped the ball. They have really, really dropped the ball. I mean, the fact is, out of those 90 days, probably about 35 days in, they stopped treatment. How do you stop treatment? And then we get into this whole thing about insurance and navigating. And look, I don't know everything, but I know a lot about this system and who to call. And even with that knowledge base, there's difficulty, there's dead ends, there's roadblocks. So I can't even imagine what it must be like for somebody that doesn't have that expertise, so to say, of knowing how to navigate a system. And the fact is, now, as a family, we're rallying around her to, we either have to help her transition out of there or get the services back in place. And I'm sure the two of you are seeing evidence of this too, with families contacting you now about the concerns of their family member being in a nursing home.
It is. It's difficult, and I will piggyback on what you say, that I think the majority of nursing homes are wonderful. We have had, my dad had to go into a nursing home briefly, and it was the best thing for him. And I, like you, Larry, made the promise that wouldn't happen, but it had to happen, and they took such loving, respectful care of him, and we were forever grateful for that. Nursing homes, it's tough right now, and I get both sides. I get that they've got to restrict the people because they want to keep the residents safe. So I understand that. On the other side, you don't want to so isolate them that they can't see anyone, that they start declining. We know that loneliness and isolation is now a physical health risk. If you're lonely and isolated, it's like smoking 10 cigarettes a day. It's really bad for your health. So I know, I'll talk about Valley View, our nursing home here, which I think is the best nursing home in Orange County. They've gotten iPads for older adults so that then they can talk, they can see their loved ones and they can talk to them. And the ones that didn't have cell phones, they would give them a cell phone, or, they'd let them, go outside the window. And, is it ideal? Of course it's not ideal, but during this time you have to do that. But not every nursing home has done that. So there have been issues. There have been areas that people have dropped the ball. There have been rampant COVID cases in nursing homes where, again, you got the doors locked and everybody's got COVID. It was nothing short of scary. And if my loved one was in there, I'd do everything, I could to get them out of there. So it's a huge, huge issue. I know the health department is involved in that. I know the discussion is happening. I don't think it's happening soon enough, but there are problems. And Tim, are you seeing that also?
So we get calls from family members frustrated over the COVID restrictions. We also get calls from the nursing homes trying to discharge people when they don't have a good idea of what they're being discharged to.
Mm-hmm.
We suddenly discovered in the process of healthcare, other than family members who may not be available because of COVID, there's no real ability to put eyes and ears in someone's home to speak to the conditions and to help structure and organize care that's needed there. So then some of that stuff is coming to Adult Protective Services because the nursing homes don't know who else to call. So it's really kind of a tricky avenue. It's really not abuse or neglect oriented, but it is a risk to the person who is ill and needs to transition out.
Right.
But also, I couldn't agree with you more that when people need to go to a facility under COVID restrictions and they have to quarantine for 14 days and they don't have access to their loved ones or family or social contact and they're ill, it's really very devastating. This is a very trying time. But
I used to, when I would go visit my mother on a regular basis, at the later stages of her life, she had dementia, Alzheimer's type. And I have 2 kids, and she would always ask me, we're talking about always ask me, hundreds of times when I was there. The boys have girlfriends, the boys married, the boys have, repetitive. And the first couple, are easy to handle. Then, now we're starting to get peppered with this. So the boys have. So one day I'm sitting there, and I always tell my students, there's 2 things you take into a family's life today: your heart and technology. If you can only take one, you take your heart. But I'm sitting there with my iPad, and I'm just looking at it because Anne-Marie mentioned the value of technology in the iPad. And I have a lot of pictures on my iPad. And I was looking at the photo album, and my mother was sitting next to me. And she looked over at one of the pictures, and it was a picture of the past. And we had a wonderful reality-based conversation. And I think that, what I came across was every time I went to see her, I took my iPad with me and I had the photo, album open. And when she started to do that repetitive behavior, because there are things that you can do. I mean, that's a whole video cast all to itself. But there are things that you can do to help redirect the person, and the other, agency that's out there that's a tremendous support for all of us is the Alzheimer's Association, because they can help you come up with some strategies or guidelines in order to enhance that interaction to make it more positive. But I think that, it was very clear that when we started to look at what was the focus going to be, veterans for sure, nursing home residents and their families for sure. And then the third one are families with individuals with special needs. And again, remember, we're talking about how we arrived here is really based about how to navigate these systems now that we're addressing COVID. So let's talk about that for a second. And I just want to start the conversation with this. There were a number of studies that were done that showed, I have 2 kids and I'm going through that, for a number of years now, that disengagement, not disconnecting, but disengagement. So I'm not meeting school buses, I don't have to look at my watch and say, I got to be out of here in 5 minutes because my kids are coming home on a school bus or anything like that. So that's a natural progression. Families that have family members with special needs never get to the point of total disengagement because they're continually giving voice and advocacy and interpretation of the person's behavior. Now that sounds like burden, but when we catch up to these families at a later age, we find out that the older adult parents that have adult children with special needs are less depressed than the general population of their age. And the reason is because they're still connected to purpose and meaning. Their role is still intact. And I think that, years ago, I remember, when I worked for the state in the disability world, years ago, there were 2 separate systems. We would knock on the door of a county agency back in the 80s and ask for, support. And they would say, well, you have your own system. And that system were the institutions and then the community-based services. But today, they're all blended together. Just like our title, The Blending of Concerns, are all blended together. I mean, anybody can access your services, Tim, or access your services, Anne-Marie, if they meet minimal criteria. And now with New York Connects, it used to be 60 and above. Now with New York Connect, that threshold is even decreased. So maybe you could talk a little bit about maybe some of the experiences or observations you have, both of you, for families that have family members with special needs, whether they be mental health concerns, physical disabilities, intellectual disabilities.
So Adult Protective Services has seen an uptake in new reports for families with special needs. Inasmuch as you're correct in saying that some of these parents have stayed connected and engaged because they have an adult disabled child living with them. We've seen several referrals in the last 60 days where that adult parent is becoming ill. They had lots of services of support, but because of COVID, those services of support have either gone away or have become minimized. So the disabled adult is home more. So levels of frustration are rising. The parent has or disability, and they're relying on others to provide care for them as well as supervision and support for their child. And a couple of these have become very, very complicated because the services can't go home, and it places both of them at risk. And it is not an abusive situation, but because of physical disabilities or mental limitations, they can't take care of themselves. They can't take care of their basic needs. And so the parents are very frustrated. The other systems are very frustrated. So it's proven to be a very unique challenge, but without, accusing somebody of doing something wrong. You know, that the parents, you know, they want to keep their adult child at home, but the reality is maybe you can't. Each of you, Anne Marie and Larry, you both have said you had some promises to family members, but the reality is you can't really do it. We're struggling with two of those cases as we speak today, of trying to help these families out of a really tough situation.
It's a heartbreaking situation. You know, we have several people that are well into their 90s that are caring for their disabled children that are in their 70s. And these disabled children may have some dementia and Alzheimer's issues on top of whatever other disability they were born with. The older adult can't die because who's going to take care of them? And now you have the younger child, if you will, who's a senior citizen also, really being abusive. So they don't know what to do. They don't want to get their child in trouble. You know, they made the promise they're never going to institutionalize their child. So it's a very, very, very difficult situation. Sometimes you get siblings involved and they're resentful, and you know, whenever you get family dynamics involved, it makes it, because you're dealing with your heart, and it makes it very, very difficult. You have a lot of resentment, you have a lot of shame, you want to hide this, you want to sweep it under the rug, but the reality is, you know, the older adults they can be physically, emotionally, psychologically, financially, sexually abused, and these are the hardest cases, I think. You know, if you have a stranger that does something, that's one thing, but when you have someone that's a family member that does it, it adds a whole different layer of component to it. And I know, Tim, you and I have talked about it. It's very, very hard. But again, first step is the hardest. You've got to make that call, because nothing will stop it if you don't.
And I think that, you know, both of you reference hard and difficult, but neither of you, reference impossible. And I think that one of the themes that we definitely have been able to promote through our platform here is you don't have to do this alone, no matter how complex it looks. I mean, I think all three of us could raise our hand and say, have you seen families hug it out in the parking lot of a nursing home? Yes. Have you seen families slug it out in the parking lot of a nursing home? Yes.
Yeah.
Because families, when they work, they work. And sometimes when they don't work in a particular issue, like you talked about the family dynamics and the concerns and the secrets and the shadow. I mean, sometimes it can be really difficult, but not impossible. So I think, you know, the purpose of today was to talk about the blending of concerns. And I think we've done a nice job in highlighting the three specialty groups. I know at one point we talked about that we were going to address this idea of the needs of the carer, you know, caring for the carer, the first responder. But obviously, the more we talk, we realize that that really could be a separate standalone video cast that we can do, and we will do.
Yeah.
So at this point, any summary statements, Anne Marie, Tim, before we hand it back to Alyssa?
You know, November is National Caregiving Month, and I know Dr. Force, you and I had talked about doing some special things, recognizing that. It's you know, we specifically wanted to talk about veterans on this series because September is Suicide Prevention Month, and you know, there's a lot of, not just veterans, but there's a lot of people that are feeling very desperate, and they're feeling that there's only one way out. So we need to let you know that that's not. You know, if you know of anybody that's feeling that way, you know, again, call 911. There's help out there. Reach out. People are there. Call our crisis helpline at 311. You know, if you have any issues or concerns, give us a call at New York Connects, 845-615-3710. If it's a crisis, though, please call the police. But otherwise, give us a call, and we are here to help. So thank you.
Thank you.
Same with Adult Protective Services. There are 2 social workers available for the public to call and have a discussion with during normal business hours. 845-291-2800. Ask the attendant or follow the prompts for Adult Protective Services. So these are 2 highly skilled workers who have great assessment skills, great knowledge of the resources in our community, and so we are available. Our community also needs to understand and recognize that our local Office of the Aging, our Department of Social Services, and our Department of Mental Health are well connected with each other. For people who are truly at risk, who need that next step after the 911 call, the information is confidential, it's shared quickly, and we the County of Orange, can mount a response to any of our constituents, regardless of age, very, very quickly. And so that our community should be secure in that knowledge, that you have great professionals who work here. They're very dedicated to the craft that they work in. So I've had a lot of exposure over the years of doing this around the state and around the country. And I'm always impressed by the quality of the people who work here in Orange County across the board. So don't hesitate to call us if you're concerned or have questions.
Nice.
Thanks.
Absolutely. Well, thank you, Larry and Anne-Marie, and thank you, Tim, for joining us today. And that number for New York Connects is 845-615-3710. And thank you so much for joining us today. You've been listening to Elder Abuse Awareness Virtual Coalition. And if you want to hear this program again, share it with friends, or even comment on it, log on to our website, www.elderabuseawarenessvirtualcoalition.com. Until next time.